Okay, great. Welcome everybody to the May Board of Health meeting. We'll go ahead and call this to order. We're going to start with privilege of the floor, and we do have one individual here today for privilege of the floor, Aubrey, who is representing CNC Chucks, which is resolution number 1 in the enforcement action. The 3 minutes, Aubrey. Thank you.
Thank you. Members of the board, Aubrey and William Ober, who is one of the owners of CNC Tobacco. As you're aware, if you reviewed the minutes, you did, there is an enforcement action against CNC Tobacco. They have already been allocated 2 points back, I believe, in the last spring or winter of 2022. The Department of Health is alleging that on October 18th of 2022, my client allegedly sold tobacco product to a minor. It did go to a hearing, and I was representative at the hearing as well. And so I just want to talk a little bit about the hearing and also the substantial evidence requirement that the board has, not the board ourselves, but the health department has in order to actually enforce this action and find an additional point allocation to my client. You will see that the hearing officer has a recommendation in there as well, and the facts section is in there as well, which I encourage you to look at. One of the things that the health department has an obligation to do is establish there was in fact a sale to an underage individual. What is very apparent through the hearing is that there is no documentary evidence presented as to the identity of the individual, besides maybe some initials, no birth certificate, no driver's license, to actually verify that this individual is actually underage. And the department has an obligation to establish through substantial evidence that there was in fact an underage sale to a tobacco sale to a minor. There was no testimony from that individual, no ability for me to cross-examine that individual. And the only testimony that was discussed during the actual hearing was self-serving testimony from members who were allegedly, that were members of the health department. And so if you read the recommendation of the hearing officer, they regrettably state, and he says regrettably, state that they recommend the allocation of 1 more point. Now, what that means is that my client will be suspended for a year and he will go out of business. This is a client that has been in operation for over 20 years without any violation until the 2022 incident where there was a stipulation in place. He has been compliant for years. And if you notice, this was not a sale of flavored vape. If you look at the draft resolution, it says flavored vape. That is incorrect. It is not a flavored vape. And on page 37 of your actual PDF packet, the hearing officer specifically addresses that. And that shows the sloppiness at which this is taken into account. It is not a flavored vape product. Now, the hearing officer still recommends that there is the finding that there was an actual sale, and then reduces the fines. You, as the board members, get to decide whether or not what was presented was substantial evidence. And if there was no evidence in the documentary or otherwise, i.e. testimony from the individual, that this individual is actually underage, then that's not enough. My client, I presented to you some information, including the certification that my client has done with all his employees, that he takes this very seriously. There's signage for the store, and there is additional age verification technology that he has implemented because he takes it seriously. Now, you may say, I don't have the discretion. I'm going to follow the recommendation of the hearing officer and allot at 1 point. And I represent to you that I have reviewed your meeting minutes, and you very much do have discretion to determine whether or not there was a violation. Because you've done it in the past with Dream Vape when you didn't follow the recommendation of the hearing officer in terms of the fines and fees for a real flavored vape sale. Now, everyone is concerned with sale to a minor, including my client, which is why I'm submitting this information to you. And I ask that you take it into consideration. Is it enough to not provide evidence that this individual is actually underage to put a reputable business and that employs 5 individuals out of business? That's really what this comes down to. And so I ask that you don't find that there is a violation based on the substantial evidence prong, and you are very much able to do that. We will be filing an Article 78 immediately if that is not found, but we would not like to do that. And I'd like you to consider the information that's provided in the facts section of the recommendation from the hearing officer, because it provides additional.
Great, thank you. Any questions before Aubrey? Yes.
So 1 point doesn't shut the business down. So your client must have had previous points because they sold to minors.
So I believe in February of 2022, and this was before, I believe, the board back at that time in around March. I wasn't the attorney at the time, but this is my understanding. There was an alleged sale to a minor. Oftentimes when it's the first violation, there's offer of a stipulation as opposed to going to a full-blown hearing. The stipulation that my client signed was for the assignment of 2 points. So in any additional points is going to put him out of business.
Right. So there's been prior sales to minors
There
of
has
tobacco products.
allegedly, yes, but there was a stipulation. So yes, it's admitted by my client that there was. And then this is the sort of remediation efforts that he has put in place, trainings and others. Yes.
Was the remediation put in after those 2 points or after the third?
So you'll see the date of the certification. It's February of 2023. My client, there's an affidavit that was submitted at the hearing. My client had done trainings on his own with his employees because he was very concerned about the allegation that reemerged in October. He didn't do the certification as I see it until February of 2023. So he did do the signage and did investigate getting signage and age verification prior to that. But I believe it was just conversations with his employees, retraining him alone with his employees, not the state certification.
Any other questions? Okay, thank you so much. Okay, let's go ahead and move to the April 25th review of the April 25th minutes. If we had a board member who wants to make a motion to approve those as written, I have a first from Sue, second from Ravinder. That's Ravinder, right? I'm looking behind you. Yes. Okay. Any discussion on these corrections, edits that need to be made? Okay. All in favor is written, and that is unanimous. Brenda, I think Brenda is Frank and Brenda today. So, I'll have you do the financial summary and then go into administration if you have anything else to say about that.
Now, the April financial report is included in the packet, about 33 1/3% of the year. There really isn't a lot to comment on. This includes payroll through April 15th. And there are a number of positions at that time that we were recruiting for, or staff who were provisional waiting for civil service exams. And administrative staff are currently working on first quarter grant claims and the first quarter state aid. I really don't have a whole lot to add to the financial report.
Okay, any questions on the financial report? Before we move on. And then there isn't an administrative report in here unless I missed it.
Frank has been out due to some family medical issues and a death in the family. He'll be back next week.
Okay, so anything that needs to be shared or
I don't think
he'll
so.
catch us up next time?
Yeah.
Okay. Okay, great. Health promotion. That's Sam from afar or? Yeah, Sam. I wasn't sure if she was doing it or. There she is.
Hi.
Hi, Sam.
Hi. Hi, everyone. So I don't have much to add to my update. We are still in progress of looking at redesigning the Board of Health packet a bit. And so my team has been looking at our report and we've been having some discussion around the department. So we will continue to work on that. And then we're also planning for all staff meeting at the end of June. So that's underway. And that's all I have for the moment. Thank you.
Okay, great. Thanks, Sam. Dr. Claypack.
Good afternoon.
Noon.
Nice day out there. So I just want to remind the board that to my understanding, you're all receiving practitioner bulletins that I generate. So in my effort to keep your packet less weighty, those are sort of being incorporated de facto into my report. If that it doesn't work, or if you want me to include certain things in the actual report for the board, let me know that. In the last few bulletins, I shared information that I had shared on WHCU about certain programs of the department. And I had crafted those in the bulletins with the idea that practitioners would want to know certain items about departmental functions. But my thought was that it would probably be useful refresher information, maybe for Board of Health members as well. Because these segments that I'm doing on the department operations are crafted with collaboration of the department division that's involved. Since the last bulletin went out, there had been yet a little bit more uptick in influenza. Fortunately, the absolute number of cases is much lower than in earlier in the season, but still influenza is hanging on. This is notable because this year it began much earlier than we typically see. And it's unusual for a season to go on into May. We usually wrap it up more like April or sometimes even March. So it continues to be an issue. I'd just like to make a pleasurable announcement that article has been accepted for publication, submitted by Dr. Kaiser of Cornell, which is founded on work that we initiated here at the health department in terms of COVID-like illness surveillance. We initiated this very early in the pandemic in order to get a grip on number of cases, the trends in cases, with an idea that this data would help us potentially in department actions. It's founded on using the generosity of primary care practices to report symptoms that are consistent with COVID-like illness into a database, and then analyzing that data to see what the trends are and whether they rise to significance. The end result has been that yes, they do. And that's particularly notable because now our data on COVID is limited to hospitalization and death data. We no longer have case data that helps. We no longer have other sources of information that's real time and useful. Unfortunately, though, money always figures into these things, and the analysis of the data and the administrative functioning of collecting it, et cetera, which has largely been at the behest of Cornell and thanks to their generosity and interest in the project, the project has had to be suspended since about February, actually before February. The hope is that there'll be a grant come along and that it can be reinstituted going forward. This is particularly an issue because, as you know, we are still looking at variants of the virus, and we would expect further roller coaster trends in the future. So, but the pleasurable thing is that that this has now been accepted in the Journal of Public Health Research, and it'll be, as far as I know, coming out in print. And we can take some pride in being a significant part of that project. Thank you.
When that comes out, if you get a PDF of it, will you send it around to us?
I certainly would be.
Okay, great. Thank you. Okay, any questions on this one? Okay. Rachel, I think you're up.
Only one update from me to my report. We had an information aide resign since I submitted my report, so we will be hiring in our division for a new information aide to support our immunization clinic. And I will be posting a position for a nurse in a few weeks. So those are the only updates.
And what does an information aide do? What's that position?
Answer the phones,
Okay.
provide information to the public, support our immunization clinic every Friday, and that's basically doing the administrative side of things, checking the person in, doing some screening,
Okay.
scheduling appointments.
Okay. And that's a full-time position?
Yes.
Okay. Okay, any questions about community health? You? Oh, sorry. Okay. All right. Deb, you're up.
Budget passed without. Pension service provider.
And then can you talk a little bit about what the feedback from the community has been on that?
I think we have another parents.
Okay.
Therapists that just email me with questions to identify.
Sorry to interrupt, but we can't hear Deb very well.
We need to like walk in.
The other sound has been good. Thank you.
You're taking this day. Okay.
Yeah, just. Oh, yeah. Deb's moving. Back to.
So I really haven't received a lot of feedback from the public, just a couple providers upset and asking if I knew why, which I don't. So there were some other early childhood programs that were included in the budget, but they're a non-mandated program, but ours was not.
Okay. Okay, thank you. Anything else? Any other questions? Or? Thank you. County attorney.
Oh, I'm so sorry. I'll hide in from you. I don't know if I should give the update or let Liz update everyone. I know last time the update was that we were working on improving enforcement of the flavored vapes and with regard to the state laws and some complications that we were having with certain stores in town. We did have a meeting with one of the assistant attorney generals to improve enforcement here in Tompkins County and to try to get a clearer picture as to what we can enforce and what we really need the state to assist with, and then how to get their assistance. So we're certainly moving along with trying to improve that aspect of enforcement. Liz wants to add some more to that.
I think the only thing I'll add is that was probably at the initiative of Shauna Black.
Yep.
Our county.
Absolutely. Yeah. The legislature is definitely on board with all of this.
Great, thank you. Any questions on that? Follow up? Okay, Liz, do you want to keep the floor?
Let me know if you can't hear me. I guess I'll follow in Deb's small reporting on the budget that the flavored vapor product ban was also not included and did not make it into the state budget. Environmental health here, we continue to have our vacancy for a senior environmental health specialist with complications because of the civil service process. And so we will be hiring a temporary environmental health specialist to help get us through the summer. A retired employee is going to come back and help us. So we are quite grateful to have her assistance for the 90 days that we are allowed to have her. Grassroots is their deadlines are coming up. They have to have their mass gathering permit application submitted by June 4th. We met with them. I was unable to meet with them, but staff met with them last week. And they say they're expecting to get the entire application to us sometime the next round sometime this week so that we can do hopefully a fast review and get any comments to them before June 4th. We are having some difficulties between the plan and implementation. We have sent, I can't remember if this was before the last meeting or not, but we have had problems with their water systems at both across the way and on the fairgrounds themselves, with them not being installed exactly according to the plans. And so we're in communications with them to try to get those issues resolved. And we also have some concerns. Part of their new plan for laying out campsites is to put markers, GPS markers in, and they're not laying out those according to our field visit yesterday, according to their plan either. So, so we have some issues to resolve on the implementation side as well. So that's my update. Any questions?
General Liz, is this the only mass gathering that you guys deal with, or are there others?
Fortunately, Sue, yes, there are not even that many in the state, right? There's probably a handful of mass gatherings in the state.
Tell me
because
again what the population is for that.
it has to be 5,000 people and then continue for more than 24 hours, like with camping. So the Ithaca Festival is not a mass gathering that we regulate. They is a separate, it's related mass gathering for large events, daytimes events that they have to get through Department of Health for health and safety stuff. But for this one, there's not that many.
Okay, I just wondered if
State fair isn't one.
we had a lot and these were the only problematic ones. Whether they were special. Thank you.
Yes.
Christina Ed has a question.
Yes.
Thanks, I appreciate it. Do you feel you're getting the amount of cooperation that that you're expecting, or is it better than it was before? And do you think the dates of getting things in will be done in a timely way?
Well, they are required under their order to get in the mass gathering application by June 4th, or we don't issue them a permit. So they certainly seem to have all of the intention of getting everything in. Cooperation is subjective, right? Our concern is that they submit a good package and a good plan and that they implement it. And, some of that's going well and some of it we have some concerns with. Our office does seem to be much improved over 2022, though. But we're in a new location and will not be called the oven this year.
Okay. Any other questions? Okay, and then I've been informed that you're also the CSB.
The CSB report.
Okay.
Community Services Board met on May 1st. They completed a review of all the agencies that receive local and state funding through the mental hygiene system. One common theme was a reduction in access to services due to ongoing workforce shortages for all types of programming for adults and children. The next meeting is June 5th, 5:30 to 7. Liddy Barger, Director of Housing Initiatives, will be presenting on the recently published Home Together Tompkins, the COC's Homeless Response Plan. Reach out to Corinne if you'd like to attend that portion of the meeting. It'll be both virtual and in person at the 6th floor conference room at Green Street. It is also live and publicly available. Corinne can send out how to watch the meeting. That's it.
Great, thank you. Any comments on that? I don't know how much you can answer questions even.
I wasn't at the meeting, but Harmony is out ill,
Okay.
so Harmony sent me for a report.
Okay.
Christina, can I just add briefly? I just wanted to acknowledge that because we are meeting in May, it's not part of this report, but that it is Mental Health Awareness Month. And we had a great presence across staff across the department at the May 6th event at Stewart Park called Better Together. And I guess I'll just add that our CHW team especially is taking some time this month to do some additional training to think about their own mental health and the care and mental health of our staff, because they deal with a lot of difficult things, in their work with clients and others. So we are working on that too. Thanks.
Thanks, Sam. Okay, so are we ready then to move into our new business and our environmental health enforcement actions? So our first one on the docket is resolution number 1, the enforcement action against CNC Chucks. From board members, if I could get a motion to approve the enforcement action as written.
Oh,
I have a first from Sue.
Good.
A second from, can he vote
No,
from?
no, that's why I wanted to ask you guys, am I allowed to
I
vote?
don't think you can, I don't think you can.
Well, can my opinions be recorded though?
Yeah, you can.
You have to be a person to vote.
You have to, can you do a motion? Can you second the motion from
We're not
afar?
second, not motions, but can I actually just show my approval or disapproval of something? By raising my hand to her.
As part of discussion. Yeah, it can be part of
Okay.
discussion,
But he can't be part of any of the
Can't be a
motion.
record.
Yeah, okay. So we
Okay.
have a first from Sue, a second from Ravinder. So Ed, now under discussion, did you want to start the discussion?
Oh, no, I had nothing to say about this one. I just wanted to know for all of them, what I'm allowed to do. Okay.
Thank you. What's that? Discussion? What's that?
Yes.
She can't discuss. We already did public discussion, so discussion from board members on this. So let me start with Liz. Like Liz, do you have other to add?
So you've heard some of this and you've read your packets, I'm sure, even if it was quite lengthy. This is violation of Board of Health orders because of a previous sales in February of 2022. The underage individual did attempt to purchase a prohibited flavored vapor product, which was unsuccessful. They then purchased a tobacco flavored vapor product. So a tobacco vapor product without identification. Because of the previous ones, that this was a sale to an underage individual, and it will lead to a required recommendation to the Department of Taxation and Finance for a 1-year license suspension. In addition to the penalty, we did have a hearing for this, and the hearing officer did review the objections that were presented, and essentially concluded that the violation occurred and we don't have the discretion under the law to not cite that. He did support reduced penalty. He eliminated the $1,500 penalty that we had proposed for violating Board of Health orders and kept it at the maximum statutory penalty of $2,500 plus the surcharge for selling for a repeat sale to an underage individual. So there is a revised penalty in here that differs from the policy that we had proposed based on the hearing officer's recommendation.
That's already incorporated into.
That isn't, yes, that's incorporated into the order.
Questions from board members? Discussion? Ready to, yeah, Sue.
It just seems to me that if we believe that a sale was made to an underage individual, we don't really have a choice. My opinion.
And I guess it was in the hearing officer's report, but both the staff member and the supervisor, Becky Sims, is the former staff member, and Skip Parr, the supervising manager of the program, had at one point seen the birth certificate and had worked with the individual on multiple occasions had verified the age that way.
What is the process for getting underage inspectors? Is there there must be a process.
Yes, it's generally done, through connections so that we can have a reliable person who will show up. And then I know that they do submit their birth certificate as part of that process, but it is not ever introduced And the name of the individual is not ever introduced into anything to respect the privacy of the underage youth. But they're kept on file. I believe in admin. I think we do have it on file, but
If I understand correctly, even during the hearing, the fact that someone's identification was requested is documented, right? So if the individual was younger than 21 or not, if identification was not requested, that's not really relevant.
yes, they asked the underage individual if they were 21 and the individual did not respond. They did not ask for identification.
Okay, and so then can I just ask a couple of questions around the assignment of points, just to make sure I understand what's happening with that? Because I know that we go around this every single time we talk. Okay, so this business was previously assigned 2 points because they did sell to underage and they also sold a flavored vapor product to underage, or just they sold to underage. It's just
In 2022.
right, previously, just for selling to underage.
I believe it was just for selling underage.
Okay, and then the law requires that if they're caught again, they get assigned another point.
They get assigned 2 points. If they submit a certificate of training, it gets reduced. It doesn't matter,
I got it. Okay.
because if they get 3 points, then they get referred for their license to be set.
And so then do you suspend their license or you refer to the state?
We submit a referral to the state.
You do the,
The license is through Department of Taxation and Finance. We do not issue that.
so you, based on this, will refer to the state.
Correct.
Okay, so, let me just make sure I understand in the actual resolution. So it says they have to pay the penalty. They have to cease the sale. They have to prohibit the sale. They have to prohibit the sale and then comply with all requirements. But is there somewhere else that we're making a statement about the point? Additional,
In the resolved section,
so it's in the whereas.
sorry, yes, the
I
whereas.
see the whereas assignment of 2. Oh, I think I'm just misunderstanding this sentence. Oh, no, wait a minute. They were assigned to.
So it's the 1, 2, 3, it's a 4-3 as they were notified with enforcement order 22-0005 that future sales of tobacco or vapor products containing nicotine that result in the assignment of 3 or more points will result in referral or for suspension of its registration.
Okay, so that's a restatement of what's going to happen, right? So then it says there's an assignment of, they were previously.
And 2 points.
Right, so they were assigned 2 points then, but where are we assigning the 1 point for now, this time?
We don't assign it until this is adopted.
Oh, so it's not included as part of this.
They will be assigned a point, but we're not the ones that.
And I think the recommendation is in the last paragraph. That's for the points added. The penalty also carries.
Where are you looking?
Last page. Recommendation section. The last paragraph, the penalty also carries the assignment of at least 1 point. And given the fact that the respondent has previously been assigned children in the here. It's really resulting in us.
Oh, it's in the here, that's in the hearing packet. Oh, that's not in the board resolution. That's what I'm just asking. So
There's the whereas at the top of the second page that says Chuck's CNC Chucks will be assigned 3 or more points, which will result in the notification of the appropriate agencies for suspension.
oh, I see. I understand now.
you guys talking? I can't hear you, but.
No, we're not, Ed, sorry, do you want to add something?
Well,
I'm
I
just-
had trouble hearing the last person talking, and there was that last paragraph of the hearing report that says, however, the law does not allow for such discretion. The law cited above states that upon the finding of a violation, points shall be assigned. So we don't have any discretion upon that, do we? Is that?
No, that's how I interpret that as well. I think what I wanted to just make sure that was clear was that in the resolution, that it was clear that there was the additional point that was being assigned. And I think I was just looking for a specific whereas, but I understand with Liz's explanation why it's included in that whereas and that what's going to happen. That's on the top of this. I don't know what page in the board packet is, but it's the second page of the resolution.
And to reiterate just to be clear for what the concern that was raised at the start of the meeting, I think the respondent is saying that there was not sufficient evidence of underage, so that gave you leeway in assessing whether a violation occurred. So I think that's some of what it will be presented if this goes forward in a potential Article 78 case.
Yeah, so that was actually my other curiosity question. What's in Article 78?
I'll let Holly deal with that one.
It's basically a motion that can be brought requesting relief from the findings of
A motion that's brought to who?
to state. I've never filed an Article 78, but it's just my understanding that it's the type of motion that's brought to ask for different relief.
And it goes through the appropriate court system.
Right, it's to the Supreme Court, but similar to an appeal. Yeah.
Okay, thank you. Thanks. Okay, any other additional questions, comments, concerns? Yes. Rebecca.
So we have proof that this person was underage.
We do. It was not presented during the hearing it was presented verbal confirmation that the individual was underage.
Well, just to be clear, there was verbal confirmation at the hearing, but you have on record here at the health department, the information that substantiates that the person is underage. And that the hearing officer found that that was sufficient documentation and evidence based on previous court cases.
And that the clerk didn't require identification.
Right. Okay. Any other comments or questions? Okay, all in favor of the resolution as written? I think that's unanimous. Just make sure any abstentions or opposition? No. Okay, let's go ahead and take up resolution number 2. We're switching gears here to the next 3 are food related violations. So violation number 2 is related to Chili's Grill and Bar. So if we could have a board member who'd like to get the discussion started with a motion to approve the resolution as written. The first from Melissa, a second from Samara. So Liz, could you get us oriented here? Anything?
It's a cold holding violation from inspections on February 6th and February 28th. It's actually related to equipment, inadequate equipment. We have proposed a $200 penalty in accordance with our penalty policy. There were also other blue sanitation violations, but this is focused on the cold hold room.
Any questions on this one?
Just check the written. Is there requirements to fix the equipment? Oh, so they need to just maintain the equipment. Yep. Okay.
Okay. You good? Okay, any other questions or comments from board members? Okay, all in favor as written? That is unanimous. Okay, resolution number 3, Chipotle Mexican Grill, another food violation. Someone would like to get us started with a motion to approve as written, resolution as written. A first from Ravinder, a second from Samara. Liz, if you could just get us oriented here.
This is another food service violation or hot holding violations on February 6th and February 28th with the similar $200 proposed penalty.
Any additional questions on this one? Let me give Sue a minute to you. That's okay. Sure. Any questions over here? Comments? Okay, all in favor of the motion or I'm sorry, all in favor as written? And that's unanimous. Ed, did you? Okay, sorry. And then our third resolution, I'm sorry, our fourth resolution is related to authentic jerk. Now, this one we have a change that everybody should have in front of them that was given to us. So I think what the motion needs to be on is not what was in the packet, right? But what this edit that was handed out. Correct?
Yes.
Okay.
Not sure how that process is. I guess you can just do it for the amended resolution automatically.
Yeah, we could put it under motion and then I'm going to turn to the county attorney here. We could, since Frank's not here to whisper in my ear and I made fun of him last time and now I really need him and he's not here. So we can put it under motion. Do you want us to put it under motion with this? Should I reject this that was before, that was in the packet and it's this revision that was handed to us? Or should I do a motion on this and then do this as a friendly amendment and vote on the amendment as an amendment? Preference?
I believe you can make a motion to withdraw the first one.
Okay. Because I was going to say, I think there's a couple of ways we can do it, right? So let's make.
Probably easier to just withdraw the one.
Yeah, so I'd like someone to make a motion. Okay, first from Sue, a second from Lisa. Any questions or discussions on this motion? Okay, all in favor to withdraw this motion to replace with this, this document with this. Okay. So now we're talking about this one, which was handed out, which has the edits in it. So now I need a motion to approve this resolution as written. First from Sue, second from Dr. DeLima. Okay, Liz.
Yes, I apologize that we noticed at the last minute that one of the orders had not been transcribed successfully from the stipulation to the resolution. So this is modified to address both cold holding and hot holding violations. This is a temporary food service establishment. So it operates under a different sanitary code than a full service food service establishment. And so some of the wording is slightly different than in some of the other orders to reflect the different code. But they had, just a second. So they had temperature violations on February 24th and March 10th. And so we're having a proposed penalty of $200.
Okay, any questions? Yes, Sue.
So is this a food truck or is this someone
it's a
cooking out of their house and delivering food, like catering?
It operates on the commons.
Okay,
I believe they are going to be having a regular restaurant,
okay.
right?
Oh, they're.
Moving forward that,
Okay.
right? So right now they're operating out of a mobile unit.
Any other questions on this one? Okay, all in favor? As written? I think that's unanimous. That's approved. The last piece we have on here is approvals for the division fees for the upcoming year. So Liz, just so I'm clear, is there anything different than what you handed us here than was in the packet? That we need to withdraw one?
Oh, no, this is a hard copy. It has 11 by 17 tables. That might be a little bit easier.
It was hard to get, so easier to look at.
Yeah.
And you need and Liz, you need us to approve this, right? Or,
Doing this
okay,
are approved as part of the budget process.
okay,
I think the budget will be coming to you next month.
okay.
In the event, we're getting these to you in advance so that you can review these in more detail.
Before we have to do it. Okay, so could you just walk us through? I think that you had put in red for us most of the things
Yes.
you wanted us to focus on.
Changes.
Yep, and then just a kind of the summary. But could you walk us through those really quickly so that we know what you want us to know?
Yes, so the main changes are to our mass gathering fees. We have operating fees, which essentially covers the inspections. And, we're not finding that the time required for our inspections is decreasing. We used to have, we currently have a different operating permit fee for whether you're an existing facility or whether you're a new facility, because we're expecting more work if it's a new facility, but we're not finding that the work level is decreasing with the existing facility. So we're combining those fees into one fee at the level for the new fee. So we'll have one $4,100 fee, operating permit fee for both new and existing mass gathering events. Then we are also increasing the mass gathering plan review fee, which is kind of the permit review that we go through ahead of time. So we're increasing it for existing facilities, which is the Finger Lakes Grassroots Festival, proposing to increase it to $7,500. We also want this to limit 2 rounds of review of the application. And then if they require additional reviews, that we then have half of that fee for additional reviews.
So is it 7,500 for the first one, 7,500 for the second, or it's 7,500 for the first 2?
7,500 for 2 rounds of.
Got it. Okay.
And is your expectation that 2 rounds of review should be adequate?
2 rounds of review is adequate for most facilities.
Okay, thank you.
So, and these reviews are quite extensive, right? If they, from the comments we give them, they should be able to revise it after 1 review and not need a second review. Or the second review should just be like a few details. So this is increasing the fee for Finger Lakes Grassroots for 2024. It would be a total of $11,600, which is an increase of $3,500 over their 2023 fee. And this might get us to covering approximately 20% of our staff time. And the only other fee, I think, is the on-site wastewater treatment system fee that we're proposing a slight increase for new systems, $450 up from $425. That last one was in 2020. Oh, we increased it in 2023. That's what I have written down. We're seeing a slight decrease in our cost recovery on these, so we are trying to increase it a little bit, being cognizant of what other people are going through. And then we are also seeing issues with our permit fee related to those plans that go to outside engineers. So so that one's also,
And I see we have made it to 2023 and we're not making copies for people anymore at 25 cents a copy.
oh yeah. We are getting to that. Yeah, so we are eliminating the fee of the decrease in the fee if for things that go to an engineer or replacement systems. We're just finding those are often troublesome sites to begin with or troublesome use. And we also have proposed a permit redesign fee if it is because of the property owner. So we go out to the field, we design their sewage system, we issue the permit, and then sometimes, they don't want the system here, they want it someplace else, and we end up redesigning it. Or other times they've come in and done something to the site so that the system that we put in no longer works in that location. So in those instances, we want to charge a permit design fee. There are also times when a contractor goes, hey, we don't quite have the slope, the fall that we need. Those we would do without an additional fee.
And then
I think that's it.
it's approved. This would be effective July 1st. Is that
No, January 1, 2024.
next year?
Yep.
Okay. That's a higher ed budget cycle, July.
Which is not the state budget cycle.
Okay, any questions on this? All righty. Did I miss anything on the agenda? I think we've covered all our items, so I'm gonna go ahead and adjourn us here, just as a heads up for folks, I'm not here next month because I'm on vacation, so is gonna be in charge, so have a great June and I'll see everybody in July. Thank you for your time. We appreciate it.
Good job today, Christina.
Thank you. Yes.
And everything like that.
I want everything fixed by the time I get back, right?
Yeah.
I mean, I don't want to recut it.